Hey guys, welcome back to another episode of the Mind Muscle Connection podcast. Today I have a very special guest on, Arianne Missimer. She is the founder and CEO at the Movement Paradigm and is an Institute of Functional Medicine certified practitioner, a doctor of physical therapy, a registered dietitian, a powerlifter, and a TEDx speaker as well too. And I also, as I was diving into some more information, she is a cancer survivor as well as an American Ninja Warrior competitor. That's super interesting.
Yes, it is. That's my claim to fame.
First, thanks for coming on. Super excited to chat with you today. We're going to talk about nervous system regulation. I think that's going to be super interesting for the audience. But first, I did want to just touch on that. When was American Ninja Warrior competition? What was that like?
Sure. Thank you for having me first. So that was after I was diagnosed with cancer. So that was in 2016, so season 8. And I had got diagnosed with stage 3 liposarcoma 2 months before my wedding. And I decided that I did not want to just survive cancer. I wanted to thrive. And so I, like any normal person would do, began to train for American Ninja Warrior during treatment. So I was doing chemotherapy, proton therapy, and I was also got surgery, limb sparing surgery, and I trained for it during that and then competed 4 months after. And it was amazing. It was one of the most amazing experiences, mostly because I beat 2 obstacles, which was cancer,
Yeah.
number 1, and then number 2, American Ninja Warrior.
Yeah, no, that's really cool. Yeah, I think that's super interesting and some things to dive in there. As far as the training goes, was that anything specific that you had to do there? And then obviously with you going through cancer at the time, was there anything you had to work around during that time?
Of course, yes. So I went to a local ninja gym. So I've always done strength training. So that was always a foundation, but it was very specific training. So I was really just working on a ton of obstacle training, everything from rock climbing to parkour to true obstacle training. And yes, I had to navigate around treatment for sure. But even when I got surgery, my husband actually built a little ninja gym in my basement. So I was still pulling myself up on things.
That's awesome. Yeah. And then I guess with being a cancer survivor and stuff like that, were you already into the health and fitness space, like leading into that and everything? And so was that something that maybe was able to kind of help you throughout that process?
Yes, 100%. So I would say since 17 years old I've always been active even prior to that, but that's really when I got into fitness. That's when I started strength training and it just became a huge part of my life. I lost my brother to cancer, and I always say that he gave me my purpose, which is to help people change lives, to never take health for granted, to never take movement for granted. So I've been obsessed with the human body ever since then. And it has also helped me heal through a lot of adversity. And I jokingly say that when I got cancer, I feel like I had trained for it my whole life,
Yeah.
mentally, physically, emotionally. And I think that's what I want to share with others is to be able to be resilient, to be able to adapt to whatever comes your way, whether it's a chronic disease or whether it is a family stressor, but just being able to adapt to anything that's coming.
Yeah, no, I think that's awesome. And again, I think with the nervous system regulation and just overall stress load, I do feel, and we're going to dive into all this, but I do feel like people think of it as like just having no stress. And then, like you said there, I like that you mentioned the stress resilience side of things as well, too, and how important that aspect of it is. I guess then for you, was there any big takeaways that you had going through that process? And again, taking it probably from a different lens of how most people usually go through that process there with not necessarily having probably a good health and fitness background and everything like that.
Yeah, I think the biggest takeaway for me, which everyone has one when they experience cancer, I believe, or any chronic disease, is that I realized more than ever at that time the emotional and mental impact on it. And that I realized that I had not processed a lot of trauma in my life. And I think personally that leading into my diagnosis, I think that I was carrying stress, even though I didn't really know it. I was maybe repressing some things that just cruising along and doing life and working and having fun and getting married. So it was all good things. But I learned a lot about that. And that's actually what really I would say propelled my desire to learn as much about the nervous system as possible. I did my graduate work in mindfulness. I did my yoga teacher training. I did somatic work and just really began to look at true whole body wellness. Because even when I went to a functional medicine practitioner after treatment, it still, to me, wasn't whole body wellness. It still was, oh, you have this wrong and you have this wrong and you have this wrong and you should take this supplement and you need to do this test. And it wasn't really looking at me and what I've been through and what where I want to go. And so I just said, I'm going to change all that. So I also went back to do my training in functional medicine because I just want to do it different. I want to look at the person in front of me and truly appreciate their unique lived experiences, where they are in this moment. What do they need? Because it's not always another supplement or another test or another diet. It's mostly the nervous system. And I think the more work I do, I just keep coming back to that over and over again.
Yeah, no. So it sounds again, the whole kind of concept of like functional nutrition is, or functional medicine is, hey, we're taking that whole body approach. But you found that they really didn't take that kind of whole body approach. And it seemed like the biggest thing that was missing, from my understanding, was looking at the individual's like kind of experiences and things that they've gone through in the past. And my understanding is, I continue to learn more about it. That is a huge piece of all this, is that is going to play a huge role in the nervous system in terms of how you deal with things.
Correct, because you cannot heal if you are not safe, period. And so what happens is people are in this fight or flight. They're constantly fixing. I need to fix this. I need to fix my gut. I need to fix the parasites that I had. I need to fix the mold issue. They're always in fix it mode. And I was. So that's why I know for sure. And because when you're being told that you have all these things wrong and there's all these things you need to fix, your body is not broken. Yes, I had a lot of physical issues from treatment for sure, but it doesn't mean that I'm broken. I'm never going to get better. But I was in subconsciously feeling that way because I was trying to do all the things for years and wasn't feeling better. And then I just finally had to take a pause and say, I'm going to focus on my health and my well-being, not fixing everything that happened to me. And once I made that shift, it was entirely different. And that's what I try to do with my patients as well, is just help them understand to pause, reflect, recognize you're not broken and you have this innate capacity to heal, but the nervous system is going to drive all of that.
Yeah, yeah. And would you say that's the big thing that you see with kind of functional medicine now at this point, maybe where it's gone over time? Because I do feel like it is becoming more and more popular. It does seem like it does lead to a lot of people thinking that they do have all these things that they need, right? And again, there's great practitioners out there, but then again,
Yes.
with any field, there's always going to be some that, again, just hit on that side of things. So would you say that's maybe where that side of things can go wrong at times?
I do. Yes, I 100% think that, because I now have all these people reaching out to me saying right from the beginning, do you do detox protocols? Do you do mold protocols? Do you do, and sometimes it's hard for me to answer because the answer to that is yes. But when I listen to them and I'm thinking the way that they're asking me and their thought process is they're just going into fix it mode. Like they don't even know what's wrong. They don't even know if they have mold or they need to be detoxed, but they think that they do. And so it's really being able to guide somebody on that journey to say, okay, yeah, we might get to a place where we do have to support your detoxification pathways. Sure. And that's important. And we do need to maybe test your gut because you have infections or pathogens or leaky gut. So all of that is important, but it's just like still being able to do it in a very meticulous way to guide somebody into a place of safety and is safety in their body so that they are not constantly thinking that they have to do this, they didn't do this, they're frustrated with what's happening, and they can actually just be present.
Because all that, to me, thinking about all those things, that's just another stressor on the body that's going to impact the nervous system. The thing you're trying to do is just making it worse. And I would imagine too that a lot of people that come with those like type of thoughts are already that's something that they need to work on in general too. So it just makes it even worse, even though that's the thing that, like you said, eventually that might be the way we go down, right? You might work on a detox protocol, but again, that your whole thought process around it could be the thing that's really causing you to just make things even worse.
Yeah, and I think it's even just the language that's used too, is just how we're talking about it. And I always have to pause and just think about how I'm explaining something to someone because of my own experience. I just feel like I just want to make sure that they're not walking out feeling like they're broken. And so I'd have that every time. I'm so intentional about, okay, like this is what's happening, but we can address this. This is not a problem, but we do have to make sure you're sleeping and you're breathing well and all of these other important aspects before we go to all these different supplements and treatments.
And I do want to hit on this later in a little bit more detail, but I'm assuming this is too where like the whole concept of stress resilience comes in as well too, right? Because I feel like, and you may have already kind of hit on this, but it can lead to you thinking that like the human body is a super fragile like thing, right? And we're super adaptable, I feel. And so it's I'm assuming that's where the whole kind of stress resilience thing comes into play too, right? Because in today's modern environment, and again, with all the information people are being fed, it's like it's super easy to find, oh, this is wrong, or it's the mold, or like you said, it's detox, whatever it may be.
Right. And I think that we so often are thinking, I'm stressed, so I need to calm down. So I need to breathe, I need to downregulate. And those are all, clearly my work. So you know that I think all of those things are super important. However, the big picture is that we have to teach you how to adapt to life, period. Because everything's a stressor. Exercise is a stressor. Speaking to an audience is a stressor. So you have to be able to ebb and flow and have really good coherence and be able to have that resilience and stay, I was saying, that resilient zone where you're not bumped out for too long in that hypervigilant, anxious state, but you're not bumped in that low hypoarousal, shut down state. And that even if you recognize you're there, then you come back to center, you come back to that resilient zone where you're like, okay, cool, I can handle this.
Yeah, no, I love that. And again, like you said, it always just comes back to any sort of issue comes back to the nervous system there. And I also feel like too, with your background, I mean, with functional medicine, doctor of physical therapy, registered dietitian, I feel like you have a nice kind of vast education around, like you can bring different, like it's all the same kind of industry, but it's like different kind of branches of that industry as well too. And so I guess what did you start with first? Was it being a
Mhm.
registered dietitian? What did that kind of look like?
So I started actually as I wanted to do physical therapy. I always might laugh because I didn't do my first year of school. So I had to switch. So I switched to nutrition. And during that time, that is also when I began personal training. So I was really trying to do nutrition and fitness from the beginning. I actually did a fitness competition, two fitness competitions, and that was awesome in that I did it and I checked that box, never want to do it again. But it made me learn a lot about how I can begin to just help people truly do this in a healthy way. And so then I was working in a fitness setting and I had my own personal training studio at 21 years old. And all these people were coming into that setting with pain and injury. And I said, you know what? I really need to understand pain and rehabilitation. And why are people going to physical therapy and still hurt? And so that's where I did my doctorate. And then fast forward, it was post cancer treatment. Then I got into all the mindfulness work, nervous system, then functional medicine.
I feel like that's a evolution of people that get into fitness, right? It's again the kind of the competition style. Like I'm assuming it was like a bodybuilding.
Yeah, Miss Fitness in America and Miss Figure USA. Yeah.
Gotcha. Yeah. I feel like it's usually that. And then it's, if you're really into this stuff, you want to dive deeper and then it becomes more of, again, the whole body kind of approach. I feel like that's the evolution there with that. As far as your kind of current training and nutrition goes to, what do you practice there with that? What is your kind of, yeah, actually, sorry, let me back up because I do want to hit on this real quick before we dive into that. You also have the movement paradigm. Could you maybe explain that a little bit more to the audience?
Yep. So it's an integrative health center. We're in the Philadelphia area in Pennsylvania, and we focus on whole body wellness through integrative and root cause medicine. So we offer functional medicine, holistic physical therapy, nervous system regulation, and obviously a lot of different services within those, from visceral work, pelvic floor work to craniosacral and somatics, and really just looking and treating the whole person.
And I'm assuming which kind of direction you go and what you focus on is probably going to be based on, again, just what that particular individual and client needs and everything like that.
Yeah, so when they're coming in, it depends on if they come in through the lens of PT or they're coming in the lens of functional medicine and really just guiding them on. And sometimes it's not always with us. So I refer a fair amount of if I think someone needs something very specific, whether it's mental health, counseling, it's trauma work, it is airway health. I might make a very specific recommendation, but even with that, I'm very sensitive to that because when someone comes in to see us, they're trusting us and they're believing in what and how we're going to help them. So everything matters in terms of timing. And for like right from the get-go, oh, you should go see this person, then already we've overwhelmed the system. So we always put nervous system first, front and center, regardless of where they come in, even as it relates to my colleague who does a lot more of the pelvic floor work. We don't do a lot of internal work because so many people have trauma. And we really like, so that's standard across, at least in the US, is that you go to pelvic floor therapist, they're going to do an internal. And of course, we're trauma informed, but we also are really understanding where they came from and is this appropriate for them at all or right now. And so often it's not. Just things like that, like just making sure that we really know their timeline and what their specific goals are and what we need to do.
Do you work, is it all in person or do you do virtual work as well too?
Both,
Both.
both.
That's awesome. Yeah. So again, I love that again, it's just very, again, what that person needs. And there is so many different aspects that you can go. And again, it is the whole body there.
Yep.
So as far as your training and nutrition goes, I think I recently or saw that you recently did powerlifting competition. Was that your first one or had you done that
Yeah,
multiple times?
that was my fourth or fifth one actually.
Nice.
So yeah.
Is that what your training is usually around? I know, again, you've done American Ninja Warrior training as well, too, but is that really kind of what your focus is on is more like kind of resistance training or what does that look like?
Yeah, so right now I do one powerlifting meet a year. I do aerials, and then I do a lot of other things like rucking, running in between. But I like to just set goals for, like I said, like the powerlifting meet. I wouldn't want to necessarily do powerlifting meets all year round, but I love doing the one. I love pushing it and then switching my training. And I work with muscle nerds, so it's great to just have an amazing program and be able to navigate all the things that I want to do because I always have different goals.
Yeah. And they're good at,
Amazing.
yeah, they're good at doing different type. Like if you want to do more like athletic style or again, power, like they're definitely good at switching that up instead of just doing, say, hypertrophy training or anything like that. And then from a nutrition perspective, is there anything you specifically do there? Do you track or is it like, what does that kind of look like on your end?
Yep. So my philosophy on nutrition is really nutrition optimization. So I like to think of not so much taking away everything. So this is with my patients and myself is just how can I add more things in? So I'm always thinking of anything from adding an herb or a spice to different fruits to vegetables and so forth. And I'm pretty obsessive about protein. So that's, if anything, I sometimes need to decrease my protein intake. But overall, I would say I'm probably about a 98% to 2% person. So I eat pretty healthy, mainly because I just want to feel good. It's
Yeah.
not, I think just like post-cancer treatment, I always want to feel good because I always want to have energy. I always want to do a lot of things. So that's how I view it. I never feel guilty if I eat something not as good, but I just really enjoy trying to eat to feel my best.
Yeah, no, I think that's awesome. I think yeah, train eating to feel like to feel your best,
For
but also to feel
performance.
training. Yep, and to just feel good. I think performance is also just and performance in life as well too, not necessarily just
Yeah.
your training sessions.
My hardest is is doing the powerlifting meet because I have to eat so much. That's when it's like that's when I'm
Yeah.
ready. That's the one thing that I'm kind of like, all right, I'm over this. Eating
Well,
like about 3,000 calories a day is a lot for me.
do you like ever have like periods of time where you focus on, say, it sounds like you do, but gaining weight, cutting? Do you go through those cycles, or again, is it more so just, hey, most of the time I'm just focused on feeling to feel good? There are some times that call for pushing my body weight and body composition certain ways.
So last year I did a cut from, let's say, it was probably about 3 or 4 months. And then really after that, I increased my weight slightly during just training for the meet. But now I'm just going to stay in maintenance for a while. So I would say most of my time is maintenance. And just, I'm not saying that I won't do an intentional build again, but it works out just that doing it during the powerlifting season works out. Intentional and unintentional, if you will.
Does that involve tracking for you, or do you try to eat based off of, again, just obviously
No.
you have the experience, the education, and so is it more based off feel and everything like that?
Yeah, so I will do a little preload and just understand what should my macros be and calories be, and then I won't track. And that's just personal. It's just not my thing. It's for a lot of people it is it's just a trigger. It's more just annoying to me, and I feel like I'm obsessing with it, and I don't enjoy it, and I love eating, so I'll track just to, like I said, just to figure some things out, very minimal. And it normally works fine. Even just in my last cut, I did a DEXA and was at 12% body fat. So, and I didn't track the entire time. So
Yeah.
it was just really, I'd prefer that for me personally.
Do you ever tell clients to track initially to get some sort of education, or is it again just kind of case by case basis in terms of where they're at and everything like that?
So I do two different versions. So I do work with a lot of people who have a past eating disorder or current disordered eating. So it is It really depends. So if they have experienced that, if they've had an eating disorder, I will not have them track at all. I won't even actually talk about it. But I will try to educate them as we move through nutrition and just really that, hey, let's focus on, it might be something like adding non-starchy vegetables. Let's get more fiber in. So it might be that type of education. But when it comes to if I really need to figure out what somebody's doing, I might just have them talk me through what they're eating and I will enter it. So I'll do the
I see.
nutrient analysis. It's just hard because it's so triggering for people even to talk it through. I just as an example, I would give this happened probably 4 or 5 times where it's inevitable that if someone has a long history of an eating disorder, they're also going to have digestion issues. And then when you try to focus on digestion, that can be very triggering. So if someone is really just tuning into, oh, I have to chew my food and I want to be in a state when I'm eating, those things can really set people off. Like I said, it happened about 4 or 5 times to me. And I was like, oh gosh, okay. And I didn't even think about that. So I try to be very sensitive and just make sure I have an open, honest conversation with them and just have them like tell me what they're feeling. Like, hey, if something comes up, if something feels triggering, just let me know. So
It almost reminds me of the sleep thing, right? Where it's, hey, get more sleep. And then that causes a lot of anxiety and stress around sleep.
yeah,
And then people don't get good sleep. So it's the same thing there with, like you said, the
yeah,
digestion. Hey, focus on these things, but then that causes some
yeah.
more stress and whatnot around that. Again, I always love talking about training, nutrition, kind of what the guest does and stuff like that. What I want to kind of switch gears to is why I brought you on here to talk about nervous system regulation, just the nervous system in general. And we've already talked a little bit about it and already dove into it a little bit, but I want to get into some of the nitty gritty there. So I think to start it off, maybe just to give everyone a kind of a refresher, and maybe they're not familiar with it, what just a general overview of the nervous system, and then maybe why this is something that we do want to start to pay attention to, even if you are just body comp focused.
Yeah. So just say high level, we have central nervous system, so brain and spinal cord. Then we have our peripheral nervous system. And then within that, we're going to have our autonomic nervous system and our somatic nervous system. And then we can also say our enteric nervous system as well. So today's focus, I believe we're going to focus in on more of the autonomic nervous system and just think we have our sympathetic, which is going to be more of that fight, flight, mobilize. But then we also have our parasympathetic. We can think of that as rest, digest, heal. And so with that, we'll definitely, of course, dive into this a little bit, but the vagus nerve in particular is 80% of the parasympathetic system. And that is a pair of cranial nerves. So that is our wandering nerve. So it's the longest nerve in the body, nerves. And essentially it's exiting the brain stem. And so it's coming, we have branches into the ear, we have branches into the throat, into the esophagus, into the lungs and heart, and then the entire digestive tract. So we like to think of this as the automatic functions. So our breathing and our digestion and our heart rate. So when we begin to get dysregulated, then we can get stuck in maybe that sympathetic state. We can get stuck, we'll talk about in a moment, in maybe a freeze state where we're immobilized. And we want to spend most of our time in that parasympathetic state, or at least be able to come back to that state. So even if we said, okay, we're going to exercise and we're going to move into a mobilization state, or we're going to go give a presentation, or we're going to perform in a powerlifting competition, we want to be able to go there, but then we just want to be able to come back. And that's part of that resilience that we were talking about. It's like people think that it's bad to have higher cortisol levels, for example, but cortisol is good. It's so important. We need it to do so many great things. It's just that we have to have the adaptability to come back to that basic state. So that's high level. We can dive in more.
I guess then for people listening, okay, cool, that's awesome. I know a little bit more about it, but like for, again, if you are someone who is maybe body comp focused, at least coming into this, a lot of people, I'm sure a lot of people you chat with too are body comp focused too, but like for them, like why would this be important? Like why would they want to know, why should they focus on their nervous system?
Yeah, so for the people that are really focused on body composition, we want to be thinking of if you're trying to truly reach your peak, whether that's from an aesthetic standpoint, that's a performance standpoint, metabolism.
Yeah, cool. That's a great kind of high level view of the nervous system. And so I guess for people that are body comp focused, why do they want to know about it? And why is this something that you think is important for them to focus on?
So if a lot of times the people that are body comp focused are also sometimes the people that are in that sympathetic dominant state. And so that is actually going to influence everything from sleep to overall recovery, your ability to recover from a challenging exercise. It's going to affect your metabolic and mitochondrial health. And it's also going to have ultimately a downstream effect on every potential system in your body. So the longer people are in that upregulated state, you can do that for a while. You can cruise on cortisol and adrenaline. And those are actually the high performers. Those are the thrivers for a while that just thrive in the chaos and, oh, let me push it harder, let me work harder, let me add more exercise, let me add more training, I want to get lean. So those are sometimes the people that like they could go and then all of a sudden things just start to go wrong. And it might start with just something little. It might start with just, oh, I have some pain, I have some shoulder pain that I can't get rid of. Oh, I hurt my back when I was deadlifting. Oh, I now my guts feel really bloated all the time. So it will inevitably cause a lot of physiological issues. It's just that initially you don't even know that it's happening. So the person that's like really striving for body composition, health, performance, it's literally the thing that will break you down.
And this is going to be the type of person that probably feels like they're doing everything right as well too, right?
Yes, yes. And I like to think of it, just taking it a step further, is that so think when we have, let's say, acute stress. So we have our limbic system, our emotional brain is going to be threatened by some type of perceived stress or another stress. So it could be a psychological stressor, it could be a biochemical stressor, it could be a physical stressor like hurt your shoulder. So when we have this stressor, our HPA axis, hypothalamic pituitary adrenal axis, is going to be activated. So that's our normal stress pathway. That's good. Our adrenals are starting to pump out cortisol. That's good. Our DHEA starts to increase. Good, right? Maybe a little testosterone boost with that. So all of these things are good. But then as soon as we start to shift to now your body starts to adapt to that higher level of stress, now you have cortisol that's high at multiple points. Let's say if we were looking at a salivary curve. So it's point high during multiple points during the day. DHEA might increase initially, but then it's going to start to decrease. Then you move typically into more chronic fatigue. Now cortisol and DHEA are low. And then when you have burnout, so like now your body's kind of, I cannot do this anymore. And that's a lot of my population, which is going to be that 45 to 65 age group where they've just been going and going, doing this for so many years, especially women. Now at this point, they're so physiologically depleted that anything is going to be too much stress for them.
And I'm assuming too, like they're just not going to, their body's just not going to be in a good spot to see any sort of like adaptations or body comp change or anything like that at this point.
Correct. So whether you're absolutely right. So it could be I'm trying to lose weight and I can't. I'm trying to put on muscle and I can't. I'm trying to lose my belly fat and I can't. So it's like these very specific patterns that, like you said, like any adaptation that they're aiming to do, they just won't see any changes and they feel like they're doing everything right.
And physiologically, like what is again, you mentioned like, again, now at this point, we talk about cortisol. It's like we do want some cortisol, but the issue is when it's always high, then it eventually becomes low, right? You just become adapted to that. But I guess physiologically, is there anything else that's going on in terms of that happening from that perspective? I don't know if that makes sense what I'm asking there.
No, I know what you mean. Yeah. So one huge aspect is your immune system starts to be really dysregulated. So for let's say the vagus nerve, again, 80% of that parasympathetic system. So that has an anti-inflammatory effect based on this cholinergic pathway. So when we are in this optimal state most of the time, then our immune system is optimized. Our digestion is optimized. Our motility is optimized. So the longer that this goes on, now our immune system starts to get really dysregulated. So normally you're going to see more inflammation, and inflammation is really the cornerstone of really most chronic conditions. And so that will be one big thing. But you also start to deplete electrolytes. So that's one of the first things that we want to actually replete is electrolytes because it's going to help with nerve signaling. It's going to help with overall hydration to the cells. You'll start to see a lot of GI issues. So I always say chronic, typically I see so much chronic constipation. So even if someone's experiencing a lot of diarrhea, most of the time the diarrhea is a result of constipation. And so that's where, and so whenever I see that, I'm, oh, this is totally a nervous system thing. Still could be a pelvic floor issue too, but it's normally a nervous system issue. And so then with that, maldigestion, nutrient deficiencies, like all of these other physical things. And I'd say the other big one that's super common is insulin resistance. You'll see that someone will start to have, even if they're eating well, then their blood sugar starts to increase. So they'll have, because the more cortisol that there is, liver is going to dump glucose into the bloodstream. And so you'll start to see pre-diabetes, and even though they're doing all the right things, And I'd say the last big guy, there's still way more, but the last big guy would be the chronic pain. So we'll start to see central sensitization. The brain is signaling that there's pain. You have an inability to turn the volume down. And there's a lot more physiological things, but those are some of the key ones.
And I'm sure with all this too, it's like, and you kind of mentioned the gut as well too in this, and now people are lacking micronutrients and stuff like that. And this is probably going to lead to other issues down the line too, right? Like now, from my understanding, like women and men in general are going to be at higher risk, like autoimmune issues. And it's just going to lead to all these other kind of hosts of issues down the line.
Yeah, and one big area is really hormonal things too.
Yeah.
So I work with a lot. I've just gave a presentation on Wednesday on perimenopause, menopause, and I was just explaining that most of the time it isn't a hormone issue. And this is a perfect example of this because it's influencing, so our stress is going to influence the pituitary gland, which is what is also signaling to the gonadals, so testes or ovaries for women. And so that is going to influence hormone production. So as soon as we start to have that interference and it keeps going, that's one of the biggest things that will derail sex steroids.
And so, like you said, again, if somebody does have a hormone issue or anything like that, again, it's probably somewhere along the line, there's, again, this dysregulation of your nervous system somewhere along the line that's causing that. And so the goal is to figure out where that's coming from in everything, correct? And again, it's probably not one thing, right? It's probably multiple things as well too that are happening.
Yeah, it's always everything, but I will say that it normally still is in terms of hierarchy, the nervous system.
Yep. And so I guess with that too, again, nervous, I guess would you consider then, because one of my questions was like stress is, I think when a lot of people hear stress, they specifically think it's like perceived stress, right? Hey, I'm in traffic, I'm stressed. But what I've learned over time is, again, there's a lot of different things that are stressors. Again, we may have already hit on this a little bit, but can you maybe just hit on that a little bit? In that stress isn't just, hey, you had a rough day at work, right? There's a lot of things that are also stressors on the body as well, too.
Yeah, I think that's a great point to reiterate. Yes, we have perceived stress, which is what most people think of when they think of stress. But then we have physical stressors on our body. So just to give some examples of that. So that could mean you have inflammation. That could mean you have leaky gut, you have dysbiosis, you have a pathogen, but it could also mean that you have dysregulated blood sugars. That's one of the biggest drivers of stress on the system. You could have a circadian disruption, also one of the biggest drivers of stress. So then you could also, in terms of physical, maybe have like I said, an injury. You were in a car accident. So it could be so many different things. Then we have psychological stressors, which could be divorce, disease, death, and we could think of a million psychological stressors on the body. And then you have these biochemical stressors too, and that could also overlap with some of the gut things that I mentioned, some nutrient deficiencies, some like true biochemical dysregulation. So there could be so many things from that aspect too. So there's so many different stressors on the system. And then we also just want to think of good stress too. Like exercise is always such a good example of that, is just recognizing, okay, like not all stress is bad. Eustress, if we will, is called good stress. And so it just depends on, I think that's where even someone that's deciding, should I do higher intensity training or not, it is totally depends on that specific person. Because
Yeah.
it's not just a blanket statement. Like when I was talking to these ladies on Wednesday, I said, we could look at this two ways. I said, higher intensity training can actually help with visceral fat more than zone 2 cardio can. However, if you are already under a lot of stress, then zone 2 cardio is going to be perfect for you. And higher intensity training is probably the thing that you want to just wait until a later time.
Because my understanding of that with what you specifically said there is like something like zone 2 cardio is going to be something that's going to help build that resilience to the stressors. Like the hit's going to be just another like very
Another
stress.
hit.
Yeah, another just because it's funny you bring that up because I did recently come across somebody on Twitter, X now, I guess, say, yeah, I was told, hey, not to do hit cardio because it messes with my hormones. And I was just, okay, let's think about that big picture, right? Is it really the hit that's causing the issues with your hormones? Or again, is it all the other things that are going on and the hit's just obviously making it worse because you're adding that on and not focused on everything else? Because I'm assuming that's probably where a lot of people they'll blame it on one thing like that, right? Hey, hit is going to cause this, but really it's okay. We got to look at everything else that you're doing. in that
Yeah, like
process.
why is that happening right now? And so it's interesting because I speak to a lot of groups that are doing the higher intensity training, like boot camp style gyms and things like that. And so whenever I'm talking to them, and they work hard. I would say if I went into one of those
Yeah.
classes, I probably would not survive. So they work hard. But what I say to them is if you're going to do that, you need to fuel properly because they would go in at 5, I think it was like 5 in the morning for a class. So they wouldn't eat. They'd work their asses off for that hour and then sometimes not eat afterwards.
Yep.
And that is where I think to your point is just educating them. It's okay that it doesn't have to be bad. Maybe first of all, you love it. So it's important to you from that perspective. You're exercising, so that's wonderful. And now, okay, if you want to do it, let's just make sure that you're fueling properly to support it. You're sleeping well, you're eating well, you're really fueling. And I think that's a better strategy than just blaming the exercise on the problem.
And two, I feel like with how people go about body comp change, it's just all output, right? It's like, hey, super low like this is what people think they need to do, right? Super low
Mhm.
calorie, just train to burn calories. And that's where again, and then on top of it, they don't have any of these kind of lives like today's modern environment. It's probably not very conducive to the nervous system. I'm sure even in years ago, it was not great either. There's probably different issues there. But again, we're just continuing to add more and more stress onto that. And really, like you're saying there, that type of training is going to be better when you can manage the nervous system overall, work on things in your lifestyle, and also fuel for that versus just throwing it on top of all these other
Everything
issues that are
else.
going on.
Yep.
What does energy balance like? Does that impact the nervous system in any way?
Yes, and so many people, I should say, let me rephrase that. I would say a lot of the patients that I work with I don't want to speak about everyone, but men and women are underfueling. And the things that I love to educate them on is you need amino acids to make dopamine so that you're motivated to do what you need to do. You need it to make serotonin, to have a sense of well-being, to make GABA, to be able to decrease feelings of fear and anxiety, just as an example. And so like if I give that example to them, then it opens their world of, oh, like I need food to make these things. And then it opens up the door to be able to explain how if they're under eating, that's just putting another metabolic stress on their system. And I see it really, like I said, I just did a whole men's health group and they all were under eating. It was so hard for them to try it, which I was laughing because I was like, I eat more protein than that. But they had such a hard time with getting in the appropriate amount of protein and calories. And so I just think it's fascinating because then when they do, everything starts to work right. You need all of these cofactors and nutrients to make energy. And so when you start to actually put them in the body, it's like magic. Not only are you more regulated, you don't have all this additional physical stress on your system, but now you are actually expending energy, your cells are healthier, you feel better.
So with the energy balance, because I'm assuming again it's very context dependent, right? Because I also feel in this like where somebody's at is super important too, and also like how they go about that. Let's say they're in an energy deficit, right? I'm assuming how they fuel that is going to be super important, right? You kind of mentioned, hey, they're under fueling and stuff like that. I'm assuming part of that's also going to be like, again, what does their overall diet quality look like? And then again,
Mhm.
where it's an issue is if we look at their lifestyle and like everything's out of whack, right? Like they have, like you said, they have circadian disruption and things like that. So I think the big thing there is like I'm assuming you're not necessarily saying that getting in an energy deficit or being in a negative energy balance is always a bad thing. Again, it's very
Oh, no, no.
context
Yeah.
dependent in terms of where you're at and how everything else is set up in that process.
Of course, yeah. So if thank you for touching on that. No, I do not think being in an energy deficit is bad, but it should be planned. It should be meticulously crafted for the right person, the right time, the right situation. And I always say that's the fun part. That's like nutrition is a science. It doesn't necessarily have to be emotional like we make it. But I think that when I see people, like I said, they're under eating, they don't have energy to do what they want to do, and so none of their like normal metabolic functions are working properly. So that's like an opportunity to say, hey, let's get you eating more and working harder. So that way we can really begin to shift every aspect of your health and well-being.
Yeah, because again, not to beat this with a dead horse, but
Yeah.
continuing to the issue is if you're like again under fueling, but then also you're not getting any good diet quality. You're also again you have that circadian disruption, and that's where these things start to
Hmm.
stack up. And I feel like again, you can correct me if I'm wrong here, but I feel like the best way to describe that is it's almost like when you're at that point, you have to grind for every little bit of fat loss. And sometimes I'm sure in some cases it's not going to happen, but you have to really grind for it. Whereas if you can take care of the nervous system, like we're talking about here, everything I just feel like is going to just happen more effectively and efficiently, really, I guess is the best way to describe it.
Yeah, and I think in terms of context, again, it depends on is someone in their last 3 weeks or 4 weeks of doing a show, or is it just someone that like wants to get as lean as they can to be healthy? And I think that is a different conversation. Like when I was doing my cut, like I said to Max, for if I said I feel so good, I didn't really want to stop because I just felt amazing in my cut. It's at the very, very end of it. And so I want everyone to feel like that when they're doing it if it's done the right way.
Yeah.
And not that and again, no, not to say if you're getting ready for a show, that's a different conversation, but just a normal, healthy fat loss program that like I want them to feel good the whole time. And then recognizing those signs of if you start to get too lean, your libido is going to suffer and your mood is going to suffer and you're going to be irritable and all these things. Your sleep's going to suffer. So just being able to tune in because so often we're tuning out. So that's the concept of interoception where we're on autopilot, whatever we might be focusing on a specific goal, but we're not tuning in to our internal awareness, which
Yep.
is breathing and our heart rate. And do we have pain? And are we hungry? Are we full? And if we do that sooner, then we don't get to a point where our bodies are falling apart, whether it's in a fat loss journey or it's just that now you have all of these chronic health conditions.
Do people almost just adapt to that and become accustomed to that type of feeling, right? If they're not really paying attention to it, like they almost just think, hey, this is normal. This is how I should feel. And people just walk around that way without really realizing it.
I think so. I think so because when I'm preparing for my evaluations and I see all of the things that people have checked, which sometimes could be 50 different or more symptoms, I just think to myself, and normally it's always confirmed when we go through their verbal timeline, is that they have been tuned out for so long, for years. And sometimes that's because they've been just taking care of everybody else but them. And sometimes that is because they've just had all of these things happen and they don't know what to do about them. They've been to all these specialists, and one specialist says this, one specialist says that, and they're focusing more on symptoms than they are root cause. And I just think it's interesting, though, is that sometimes it could be 20, 30 years of people going through this and they just have so much going on. That's when I know I'm like, okay, yes, we might need to address gut, we might need to address the immune system and all these things. But like, I know the biggest thing we've got to start with breathing, sleep,
Yeah.
airway, and nervous system.
Because I'm assuming, do you hear that a lot where it's like you talk to people and they're like, oh, I'm good. I'm not stressed. Is that a common thing
All the
that you'll
time.
hear? Okay. So that is a normal thing. And I guess again in that situation is it just asking the right questions, understand like just taking inventory of like where things are at, and then so that way you can build that up of okay, here's where we need to start. I know you don't necessarily feel stressed, but your body's under a ton of stress.
And I would say I have a fair amount of those conversations and just trying to really, I do know what questions to ask. And I have a sense of when they start to talk about certain things, I might ask them, how do you think that's impacted you? Do you think that you have processed it? So, for example, when someone starts to talk about something, and it could be really random, it doesn't always have to be a really tragic event, but it was tragic to them, and that's what's important. And so they might start to talk about it, and they don't even know that all these feelings are there, and they start crying. And I think I'm like, this is wonderful. I think this is great because they're opening up, they're expressing it. They didn't know it was there. They feel terrible about it at the moment, but I think that's such a positive thing. And so sometimes just talking about it can be enough for them to just process some of the things that they've been holding on to. But sometimes I really do have to explain to them like why it does present as though they're under stress. And that might be more of the physiological stressors. So the thing that we haven't talked about just yet, but I see all the time and I'm always looking for is, so I always say in the hierarchy of things, it's breath and airway function, affecting sleep, affecting nervous system, and then everything else. So if they have this whole history of strep throat as a kid and ear infections as a kid and sinus infections and they have allergies, they might have asthma, if they have all these like little signs, they have chronic anxiety, then I know that they have a breathing issue. And if they have a breathing issue, they have a nervous system issue, period. So the person that presents as, I have this relentless anxiety all day long, every day, that is the person that I know has some physiological driver. Sometimes it might be nutrient deficiencies and so forth, but a lot of times it is breathing. And so just being able, I always say breathing is the window into the nervous system, and it's our first motor program. So many people have airway issues as kiddos. They have, whether it's enlarged tonsils, they have adenoids that need to not that need to be removed, but that are removed at some point. They could have a nasal obstruction. So there's all these things that could influence the way that they're able to breathe. And if someone's over breathing all day long, every day, they're going to be in this constant sympathetic state.
And breathing, again, and I'm assuming probably in today's modern environment, it's just super easy to, again, like you said, people also, they don't look within, they don't do that. But also I would imagine that in today's modern environment probably leads to the type of breathing that you're talking about there, where people are dysregulated from that standpoint.
Yeah, and so there's a lot of layers to it, but I'd say there's the physical obstruction. So does someone have a true nasal obstruction? There's an awareness. So do you just, like you said, not even know how to breathe properly? You did as a kiddo, but maybe you lost that pattern. Was there a specific traumatic event that shifted your breathing? Is there ongoing stress, like you said, that shifted their breathing? Is there a lot of inflammation that they're experiencing? Maybe that's foods, environment, and so forth. It's causing a lot of nasal congestion, preventing them from being able to breathe nasally. So yes, there's a lot of variables, and normally it is a combination of those things, but then that is a cycle that just perpetuates itself. So being able to identify that and then figure out, like, I do sleep studies on a lot. I feel like not everyone, but a lot of patients, and almost everyone that I get back has obstructive sleep apnea or upper airway resistance. And so then in that case, they're never going to heal. They're never clearing their brain. They're never restoring or repairing. So the recovery from exercise is poor. Metabolically, they're super unhealthy because they're not getting oxygen to their tissues and their cells.
And I'm assuming in that specific situation where you're talking about sleep apnea, again, like you said, something that probably impacts a lot more people than they think. I'm assuming part of it is like a CPAP, but then also, again, just finding what is like causing that and then going from there, essentially.
Yes. So you want to really identify what is causing obstructive or central sleep apnea for that person. So let's just keep it simple for today. For obstructive sleep apnea, is it a nasal obstruction? So is there a nasal valve collapse? Is there a deviated septum? Is there enlarged turbinates? So those might look different. So if you and I both had our airway evaluated and you have a deviated septum, you might get your deviated septum repaired. But you also want to make sure that you're retraining your breath, because if you're not doing that, deviated septum could come right back. So then we have things like, one of the most important is tongue posture. So the tongue should be suctioned at the roof of the mouth, touching the top teeth. And the teeth should be just very gently apart. So as soon as the tongue loses tone and throughout the day, it just starts to drop in the middle of the mouth, let's say, which is very common, or it's just touching the very tip of the teeth, then it's going to obstruct the airway as soon as you go to sleep, because you're going to lose tone. And as you get older, you lose tone. Even women have a 200% greater chance of sleep apnea going from perimenopause to menopause. So it's really common. So based on those obstructions, you would say, okay, look, what do we need to address here? Nasal dilators, for example, could be one. Using a nasal spray to help to keep the nasal cavity moist, working on tongue posture, but then just working on nasal breathing mechanics too, of like just teaching someone how to breathe. So breathing in through the nose, allowing the abdomen to expand 360 degrees, because it's really fascinating. But I would say most people really do not know the basic mechanics of breathing. Even though they know breathing is important, they don't know the mechanics of it.
And probably a lot of people don't understand that breathing is super important either as well too. But then, like you said, they also don't know how to actually breathe properly, right? I'm aware of it, but I'm still there's some things that I'm low-hanging fruit things that I'm missing from that perspective. When we talk about sleep apnea, somebody's listening to this, is a sleep study really the best way to figure out if you have that? Or can you ask maybe like a partner, stuff like that? Or what?
Yeah, so I'd say the first would be a partner. You could ask your partner if they've heard you snoring. You will not know. You won't know if you have sleep apnea, and you won't know sometimes even if you're snoring or if you're mouth breathing. So it's really important to not depend on yourself for this. And you could go by things like, do I feel well rested in the morning or do I feel exhausted? Do I feel tired at 3 o'clock in the afternoon? So those are the symptoms you might be looking at. Do I have anxiety and so forth? Your partner telling you is the most helpful thing because sometimes people like their partner told them 20 years ago. And so they've had obstructive sleep apnea probably all of this time. So then the next would be something like you could do something. There's an app called Snore Lab. So you could have it's basically like a little audio recording. So you could have that next to your bed and just see are you actually audibly snoring. And then, yes, a home sleep study is perfect. So there's something called like Sleep Doctor. Someone can go on literally and order a Watch Pat sleep study at home. Super easy. Actually, I have it right here because I was just doing a webinar. So it's like you put this on your finger, have this on your watch, put this on your chest. Super simple. And then you can get the results and then perhaps take it from there, airway dentist or so forth.
And I'm sorry, I may have missed this. Is it snoring is the main thing, or can you also have this without snoring too?
Yeah, so snore, so it is a continuum.
Okay,
So 94% of people that have sleep apnea snore. So there's a pretty high chance you're going to hear
got you.
some audible snoring slash noises, gasping, because it's in apnea, it's a complete cessation. But then we also want to consider the upper airway resistance, which is a partial obstruction. So that's where like people get really fly under the radar, but it actually can cause a lot of health issues.
Gotcha. Yeah. And again, you think this is impacting more people than they
Oh,
think. And
in a survey, there was about 70% of people said that they were home, like they lived with a mouth breather. So just that, and just mouth breathing is not okay, especially at night. Do you see what I mean? So there's a lot of dysfunctional breathing. Yes.
so trying to breathe through your nose. And again, like I noticed myself, like that's a hard thing to do. So even during some of my cardio sessions, I'm working on trying to do that a bit more.
Nice.
Just again, that's an easy thing I feel like to not breathe through your nose.
Yep. And yeah, just working on, if I were going to say just one easy tip would be tongue position 100% of the day, unless you're talking or eating, suctioned, nasal breathing, and then slowly starting to work on an extended exhalation. So when you go into your inhalation is actually a more sympathetic state. So your heartbeats get closer together. When you exhale, your heartbeats are going to get farther apart, and that's going to slow more that the parasympathetic system. So just working on that, and there's a lot of breath techniques, but just the concept of that, like breathing in for 3 seconds, breathing out for 4 seconds. That's a good starting point.
Yeah, definitely want to hit on some things that we can do to help regulate the nervous system. But real quick, I do want to hit on the concept of stress resilience and allostatic loads. Again, I don't know how much detail you want to go into those, but I don't know if they go hand in hand, but I feel like it's a good time to talk about those because we've talked about stress on the body, but also we know like you've brought it up a few times throughout that like, not all stress on the body is necessarily bad. And I'm assuming that probably goes in with these two topics.
Yeah, so when we have all of these different loads on our system, so physical, emotional, psychological, then we essentially are going to have some type of adaptation to that. So you and I might have the same exact stressor we get in a fight with a coworker. And my past experience, because maybe I've gotten in a fight with a coworker before, that's all I remember. So I'm going to just go cry. And maybe for you, you're so pissed off and you're just like, oh my God, and you just let it out and start screaming at the person. So we are going to have either adaptive or maladaptive behaviors based on those stressors. And then that is going to contribute ultimately to our complete allostatic load. So how that affects us is the physiological piece. So if we have a lot of stressors and we have maladaptations to those stressors, that's going to create more of a physiological load on our system. And so being able to teach ourselves how to adapt to the stressors more efficiently, then that's going to prevent us from having this greater physical or physiological load.
So to come back to what we talked about earlier, right, where people are like, hey, again, mold, and I'm assuming too, like just any sort of endocrine disruptor, stuff like that. It's like these things are important and we want to focus on it. But again, the body's not this like super fragile thing, right? It is
Mhm.
adaptive. So what are some things that we can, and maybe this ties into the whole thing that we're talking about here with the nervous system, but what are some things that we can do to help build that resilience to some of these stressors and things like that? Because again, the modern environment, again, it's great, but also there's a lot of things I feel like that are not great and we're not. But I also feel like we can be adaptive to some of these things. We don't have to feel like we're overly fragile to everything there.
Yeah, I think that's such a great word, which I actually use as well. So I think let's go. I like to talk about a little three-step
Yeah.
blueprint. So it depends on where someone is, but I'll reference different people. So if you are totally burnt out, you feel like I am so depleted, I feel like I'm going through the motions and I have no energy, I'm exhausted, and I just feel like I can't do anything. Procrastinating, I know I should, but I know I should walk, I know I should eat this, I know I should do that. That is the person that actually needs step one, which is a little bit of sensory calibration. So that's the person that you need to detect the world as safe. So sensory calibration could be something like this. You could put an ice cube in your hand, be like, here I am right now in this moment. You could put a lemon in your mouth. You could just gently just rub your body. So you wake up out of bed and you're just kind of, here I am. Like, I'm right here. I'm safe. I'm present. You also need the physiological piece of it would be like electrolyte repletion. So that's always like that first step where if someone's totally burnt out, if exhausted, I'll say we're going to implement electrolytes first thing in the morning to try to support optimal nerve health and hydration to the tissues. Then if you are just in that fight flight response and you're just cruising it all the time there, then that would be where the anything from breath work to other nervous system practices. So I'll just give some examples. So this could be specific vagus nerve activation exercises. This could be like humming or gargling. This could be, I have hundreds on my YouTube channel, but anything from like an ear release to abdominal massages, all of these things can influence the vagus nerve and autonomic function, or even somatic practices of just like movement based practices. It's just like gentle movement. So you are a little frustrated with that coworker and you just kind of like, all right, I'm just going to do a quick little shake it off. If you don't feel safe though, doing those things will sometimes make you feel stuck. So that's why that first step for that person is really important. And then we start to think about in that phase is blood sugar is typically really dysregulated. So I would say make sure you have protein in every meal, 30 grams of protein. You start with it in the morning. I am not a fan of fasting if someone is feeling like that. So I'll say start with 30 grams and then a balanced meal with fat and fiber, eat regular every 3 to 4 hours. Make sure you're hydrating properly. And then what you started with, which was amazing, is the movement and integration and strength part, in that teaching our nervous system and our bodies that we are not fragile and that we need to be able to load our body. So it might be one person at that time walking, and that's fine. That's amazing. It might be strength training, but we have to keep this in mind that if you're in this constant stress response, even if you're used to working out, let me rephrase this. You feel fragile, meaning like nothing feels good. So you do have to go slow. And that's where if someone wasn't working out, I would say to them, I just want you to do like isometric strength. Like I might have you hold a mini plank, like an elevated plank. I might have you hold a squat, because their risk of injury would be so low and their probability of being able to continue with it would be really high. But if it's somebody that's already in working out, doing their thing, then it might just be reorganizing their workout to make it more supportive of where they are in their nervous system. But I think that's such an important part.
Yeah. So again, it's obviously, I'm assuming it's taking, like, obviously seeing where the person's at, taking away, I'm assuming, unnecessary stressors on the body, but then
Yeah.
also, again, applying the right stressor as well, too, to help us become a little bit more resilient to things.
Yeah.
And I'm assuming, again, it's just the same kind of concept of like progressive overload and things like
Yeah.
that, too, right? So you
Yeah.
want to put yourself in uncomfortable situations. You want to have some stress, but again, it's just when it gets out of, you, like you said, the allostatic load, it gets too high, and then there's not the right stressors, too many poor stressors. That's where
Yeah.
we start to get dysregulated over time there.
Yep. Yep. Yeah. And I think that I teach this like an 8 week vagus nerve program and somatic program. And it's always interesting to see people go through that journey of where they are in the beginning and then where they finish, and them learning about their nervous system. And we go so deep into all different aspects, from the vagus nerve exercises to somatic exercises to all the nutrition and gut aspects to just every aspect of the nervous system. And so it's interesting because everybody's journey is so unique and different, and what resonates with them. And then by the end of it, I'll use this language the whole time, but is that I want you to find your path. So sometimes everyone says, how many times a day should I do these exercises? And I say, I don't know, because you might be stressed all day long and you might need to do them 30 times a day right now. But down the road, you might not need to. And that's when you develop more resiliency.
Yep. What with all this, how can somebody kind of measure? Is there anything that you do to help people measure where they're at with this? Are there, what would it be, subjective numbers or anything like that? Or is it more subjective or what does that typically look like?
Yeah, I'd say the best measure is really going to be heart rate variability. So, not everyone uses a tracker. I really love heart math. So, a lot of times when I'm teaching someone in clinic, I'll use the heart math to be able to explain coherence and help them understand how, in that moment, they can shift their nervous system. So, we might do coherent breathing or something like that. If not, though, it might be looking at other measures. So, for example, like having them wake up, and this would be obviously more subjective, but having them wake up and doing the same check in that they would do if they were checking their HRV. Hey, how did I sleep? How did I eat? What, am I stressed? Just going through that same inquisitive process that you would if you were actually tracking. I do use questionnaires and things like that too, but honestly, and even vagus nerve like actual tests you can do. But really, if we're talking what's the most objective, it would be heart rate variability.
Do you use that a lot? Because like my understanding with HRV, and maybe I'm wrong here on this, but it's somewhat like you need to have the right kind of measurement for it, but you also need to be consistent with how you take it, and that can all mess with things.
Yeah, so it really depends. So if someone is using an Oura ring, if somebody's using a Whoop watch, even an Apple, it's not the most accurate, but what I'll look at is and teach them is their trends. Is that I don't get hung up on their number, but it does give me insight though, because when I see that their heart rate variability is so low all the time, no matter what they do, then I know that there's probably a breathing airway issue. So then I would definitely look at a sleep study. But if they're able to track their trends, and it's again, even if we're comparing Whoop to Aura and it's totally different, but if we're just comparing them to them, then it does give them some insight. But I do find that sometimes people get obsessive, just like they can about anything else, and then it becomes a stressor. So I just try to use it where I think it's really most helpful for. I think it's an amazing tool. I used it forever. So I used it for probably 4 or 5 years straight. And then I was like, and now I don't at all. But I believe in it so much. It's like food tracking. It just has to be a healthy way to do it and not an obsessive way.
And I actually just listened to Andy Galpin had a podcast on stress resilience and stuff like that. And he talked about HRV and how a lot of people see a lower number and they think it's a negative thing, but it's also, hey, are you someone who's trying to adapt to some sort of stressor right now? And that could potentially make it
Right.
a little bit lower. But like you mentioned, it's when it's chronically low for you, because that's my understanding too, is it
Yes.
is very dependent on the person where they're at. But generally speaking, it's like the older you get, the low it's going to be a little bit lower.
Lower.
And then obviously the more under recovered you are, more stress on your system, the lower it will be. But the numbers in itself can be a little fickle in terms of what exactly. There's not like a standard number you want to shoot for here with it.
Correct. And I think that's going back to like you're looking at trends. So you're
Yep.
not just looking, because even if you exercise and then you train hard on a Tuesday, Wednesday, your HRV could be tanked. But that's not a bad thing. But it does mean, hey, what do I need today?
Yep.
I think
There's
that is that inquiry that I think is so important that we do all the time is just, hey, what do I need? So that's
yep.
why I said if you're not tracking it, is just doing that same inquiry that you would do with tracking.
Yeah. What about like blood work? Is that something that you would utilize here as well too?
Oh, sure. Yeah, I do a lot of labs, but so it could be functional medicine lab tests that we're looking more from like a neurotransmitter perspective, but definitely I'm looking for a lot of nutrient deficiencies specifically. So I might target things like B12, homocysteine, like looking if somebody's experiencing depression, if we're looking at zinc. So I'll do obviously D, which is always deficient. So I'll do either specific nutrient tests or I'll do a comprehensive nutrient panel. And
Gotcha.
then stool testing and all those other things too.
And then you again, we've may fit on this throughout, but like in terms of more subjectives, like how you feel, I always get these mixed up, right? Subjectives more like how you feel
Yeah.
versus, and so with that, is there anything specific that you could feel from a subjective standpoint, like heart rate, or again, maybe just like general, just like you said, anxieties? Is that kind of more
Oh,
of
sure.
the subjective things that you would look at if you feel like you're under recovered?
Oh, yeah, yeah. So I would say if you're under recovered, low vagal tone, what I feel and what I explain to people is like feeling hungover. You could feel anything from nausea to headache to fatigued. And like if we're thinking of dysautonomia, so which is more of a diagnosis, but that would be a dysregulated nervous system. You can have all of these blood pressure fluctuations, heart rate fluctuations. So you'll see your heart rate is elevated because you're more sympathetic. So yes, you can feel a lot of things if you're really just checking in and just saying, hey, like I feel pretty tired today. Like I said, a lot of people will feel nauseous when they first wake up, when they're, especially when they're chronically under recovered. A lot of times people will feel that way.
I have a couple more questions here on this before I'm going to be respectful of your time. I told you it was only going to be 60 minutes. Do you have time for a couple more questions? From a nutrition perspective, what can we do from a nutrition perspective to help regulate our nervous system? Again, understanding that everything else is going to play a huge role in this, and it's not just one, it's just one piece of the puzzle here. But I feel like we didn't really hit on like nutrition in terms of what we can, some things that we can do there.
Yeah, so I would say, I know I did mention this, but I'd say definitely at least 30 grams of protein per meal, and also keeping meal regularity. So whether that's 3 or 4 hours or so to help regulate blood sugar throughout the day to take that stress off the system. That is normally one of the most valuable things that someone can do that really will make them feel better. I don't want to diminish any other things related to nutrition, because the next layer of that is that the more micronutrients we have, the better. We're always thinking of our macro, protein, fat, carbs, which obviously are super important, but all of the micronutrients are really influencing metabolism and our ability to manage oxidative stress. And so when we can start to think of getting more colors in, like eating a rainbow, which isn't just an art, but truly a science, and that we're getting more phytonutrients and antioxidants to support our overall system. So I think that's a really good next level. But I do think that the most basic, especially when someone is feeling really dysregulated, is the protein and consistency of meals.
Do you find that when we talk meal regularity, is there, because again, I feel like you have like opposite ends of the spectrum. You have one person that's just like snacking and grazing all throughout the day. And like you said, they're not hitting that protein or anything like that. They're never full. And then that, like you said, that's going to lead to blood sugar dysregulation. But then somebody on the other end of the spectrum that's eating, they do extended fast. I know you hit on fasting, but then maybe they eat one meal a day. Are you going to see issues there from a nervous system perspective? Or again, is it all just really dependent on where that person's at?
I will say, I don't want to speak to everyone, because there could be somebody listening that's kind of, hey, I do this and I love it and I feel great. And I believe that. But I will just say that the average person, I don't think does very well with that. The fasting all day and then eating one meal a day, because most often they're overeating, they're negatively influencing digestion. They're not getting enough nutrients in. So that's where I can appreciate that someone might feel good for a while doing that, because it is a good stressor on the system.
Yep.
So I could totally appreciate that. But the reality is that the longer you do that, the harder it is to get the nutrients in you need to support health. And so I rarely find that is very helpful. I do have a lot of people that come in and are already fasting. And oftentimes I'm suggesting that because they really are not feeling great, if they're open to it, I think it would be worth exploring not fasting. And most people are kind of like, yeah, that feels great right away.
Yeah, because again, like you said, the issue is that then they overeat, and then you're also not going to get the nutrients in that you need. And then that's all these other issues down the line there. And yeah, it's hard to get, if you need 150 grams of protein or more, it's hard to get that in one single meal, and people probably aren't doing that. So again, it sounds like you said, based on where someone's at, and like it is very individual on the person, but generally speaking, you're probably looking at anywhere from 2 to 5 like type meals built throughout the day, maybe a little bit more, give or take, depending on where that person's at specifically.
Exactly. I think it depends on someone's schedule. When are they waking up? When they go to bed? All of those things. And for you and I, it might be a little bit more because maybe we're more active. I think that depends. But roughly, I always say that 3 to 4 hour mark is normally appropriate for most people, because that's how long it would take to digest and metabolize the food.
One other thing too, just to reiterate the fact that there's a lot of things at play here. But for example, in that last situation that we talked about, where someone's going to eat more at night and just have maybe like large meals late at night, is also then that leads to like circadian disruption, which we talked about earlier as a stressor on the body. So it's just to reiterate the fact that like one thing that you do could impact another thing that you're just not even really thinking about. And I think that's why I want to bring you on here to talk about different stressors on the body. And once we can start to think about that, it just kind of makes sense where you could see where things go wrong over time.
And I think just not doing anything that's super extreme is
Yeah,
always always a
the
good
best.
thing. I think when in doubt, just come back to basics and just foundation, and it doesn't really have to be overly complicated or extreme.
Yep. So was there anything that I missed throughout here? Anything that you feel like super important that we didn't touch on or anything like that?
No, I think we touched on all of the key aspects of nervous system resilience. I think if I were just to summarize it, and a good reference for everyone is Dr. Stephen Porges' polyvagal theory really explains the nervous system very well in terms of how it can express itself, where we're in either that state of social engagement where we're grounded, we're curious, we're mindful, we're present, our immune system's good, our motility's good, our digestion's good. We get to that fight or flight, and it's where we need to be sometimes, but if we're there too long, that's when things go wrong. So we could be worried or frustrated, or we could be angry or irritated. And then that's when normally we start to see all of the blood sugar issues. We start to see insulin resistance. We start to see immune issues, getting sick, not getting sick at all. And of course, digestion. And then we can go to that potential freeze state where that's that emergency state where we're just going through the motions. We're just trying to do our best, but we're not really present in our body and feeling a little shut down. And so that's when we can have a lot of other like low libido, chronic pain. And so I think just recognizing where you are in the moment is the most important starting point of addressing your own nervous system before you need to get a tracker. It's just like checking in and just saying, you know what, I think I'm pretty frustrated right now. I think I'm living in a little bit of chronic anxiety. And because if you are aware, then you know how, you might not know in the moment, but you'll know how eventually to manage it. And sometimes that could be as simple as just hugging someone, that could be going for a walk, that could be eating, that could be just trying to get a good night's sleep. So it could, and it also could be all of the vagus nerve exercises and breath work too, but it doesn't have to be overly complicated. Once again, it's just being aware and also recognizing that you are human and this is normal. And we all have this innate capacity to heal. We are not broken. We have this ability to be resilient to life stressors. But I think even just shifting the mindset towards that is also very important, and not feeling like the world's after you, and rather, okay, I need to teach myself how to adapt to all this and fight back.
Yeah, no, Arianne, a ton of great information in here. It's, I feel like in these hour episodes and stuff, we just barely scratch the surface, but I feel like you did a great job explaining it throughout and then just summing it up there. I think you did a great job to give people some actionable takeaways moving forward. So first, again, really appreciate your time. Is there anywhere where you want to lead the audience to? Where can they find you? Where can they find out more information and stuff like that?
Sure. You can go over to our website, themovementparadigm.com. And then we also have all of our YouTube channels, or excuse me, social media channels at The Movement Paradigm. So you can check us out there, do a lot of free education. And then we also have an app too, which has a lot of nervous system. We have a nervous system bundle of different exercises that you can also reach.
Awesome. Cool. Yeah, we'll make sure we link all that in the show notes. Again, really appreciate your time and we'll talk to you soon.